We live in an unequal world. The current COVID-19 pandemic has highlighted and worsened inequalities within and across countries. One of the most crucial inequalities appears in the distribution of vaccines. Worldwide, more than 5 billion vaccine doses have been administered, but they have not been distributed equally. Over 80% of people in higher income countries have received at least one dose. In low income countries, only around 2% of the population have been jabbed. But why does this unequal distribution of vaccines matter, and how does it affect us? Vaccines have been essential in protecting humans from COVID-19. With the vaccine, there's a lower chance that you'll get infected and develop severe symptoms. And if you get infected despite being fully vaccinated, you are at least 10 times less likely to be admitted to a hospital than if you were not vaccinated. And vaccinated people who get the virus are a lot less likely to spread it. If we vaccinate enough people, herd immunity allows us to reopen schools, restart the economy, and resume full healthcare services. In the UK, the vaccine rollout allowed life to go almost back to normal for many months. But if not enough people in a community are vaccinated, the virus can still spread quickly, and also has a higher chance of mutating. Unfortunately, many lower income countries have had little access to vaccines. And these countries can become breeding grounds for new viral mutations. The Omicron variant reached us from Southern Africa, and the Delta variant came from India, despite severe travel restrictions. As the virus keeps evolving, even more dangerous and transmissible new variants could eventually arrive here in the UK, with devastating consequences. Even if no new mutations emerge, poorer countries are often popular holiday destinations. It can be dangerous for holidaymakers to visit places with high infection rates, especially if healthcare services are limited. They might also face unpredictable flight cancellations or expensive testing and quarantining measures to reach their holiday destinations and return safely. Mutations of the coronavirus are especially concerning because they can render our current vaccines much less effective. We are seeing this to some extent with the Omicron and Delta variant, but things could get much worse if the virus mutates further. If a more vaccine-resistant or more transmissible variant reaches the UK, potentially causing more severe symptoms as well, we may face a range of disastrous consequences. We will have new lockdowns and social restrictions. Restaurants and bars will have to shut all over again. Schools and universities will close again and move to remote learning. We will experience more severe illness and deaths in our communities, and everyone will have reduced access to non-COVID healthcare. We won't be able to travel abroad for business or pleasure, or even short distances to see friends and family. Sharing vaccines with poorer countries, in the end, protects us and can help avert these crises. If virus levels are low everywhere on the globe, we can enjoy freedoms like traveling and socializing without the need for lockdowns or self-isolation. The healthcare system can work better, unburdening nurses and doctors. Parents can work and provide for their families. Children can go to daycare and enjoy a social and happy childhood. And students can enjoy uninterrupted schooling and university, making sure they can work towards a bright future for all of us.